Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab, all on your time, live or on demand. This is CSIS Online.
Good morning, afternoon, or evening, depending on where you happen to be. I'm J. Stephen Morrison, Senior Vice President at the Center for Strategic and International Studies here in Washington, D.C., and I'm delighted to open this very important session today on primary health care. I want to offer, first of all, special thanks to many people who helped put this all together. My colleague, Senior Fellow Catherine Bliss, who you'll hear from momentarily, and who will preside over this, has really been the lead force in pulling us all together, and we're very grateful to her for that. She's been supported extensively by Michael Rendelman and by Michaela Simoneau. So special thanks to both of them. On our production side, Mary Wright and Graham McElgiveray have both come today to make this all possible and brought their expertise, and quite grateful to them. We have a terrific lineup here today. Catherine will introduce them, but I just want to say, as a personal matter, Asaf Bitton, Nikolai Gilbert, both members of the CSIS Commission on Strengthening America's Health Security, have really been very, very active and generous, and really determined to try and elevate these issues in the work of the Commission. The Commission was formed 3 years ago, the Commission to Strengthen America's Health Security. It's co-chaired by former Senator Kelly Ayotte and former CDC Director Julie Gerberding. We have 6 members of Congress, quite a diverse number of very prominent experts drawn from public health, from diplomacy, from the development world, from industry, and elsewhere. We will be having our next full meeting on June 17th, and this issue is going to figure in that discussion, and what we say today and talk about today will help inform that. I also want to thank Carrie Peltzman from USAID. We'll be hearing from Carrie. She's been quite generous and supportive of CSIS over several years, and it's been great to have her with us so often and to have her share her expertise and insights. First point, we are very committed. This commission is going to run until 2022. And in this phase of our work, we made very explicit that we're elevating this issue, primary health care, into a priority. We've enlisted Asaf and Beth Cameron, who's joined our expert advisory group, Nikolai and others on the commission who have deep knowledge in this area, to help us think that through. What is that going to mean? I'll say a bit more about that in a moment, but we need to translate it into concrete, new and actionable recommendations. We are at a moment right now of policy innovation where a window is opening for new thinking of this kind. Even in the midst of this pandemic, there is quite a bit of new policy thinking going on. We will be issuing through working group writings, commentary, events like this, and the statement that will come out of the June 17th Commission meeting, more about what do we mean? What is it that we want to see the administration do bilaterally and multilaterally? Second point I want to make is we're already starting to see some important studies come forward with their results. Last week on the 12th, the Independent Panel on Pandemic Preparedness and Response, commissioned at the World Health Assembly last year, it came out with its report, headed by 2 former heads of state, 13 or 14 very prominent, diverse experts. They were looking at factors of failure, factors of resilience, and they put a very central focus, and I'm hoping we'll hear from our speakers today. They put a very heavy focus on the centrality of communities in the response. They identified several places in which there were major breakdowns in what should have been more carefully planned and carefully executed and prepared methods of response. And they reminded us that the role of community gets overlooked too often. There's also mounting evidence, and we heard some of this in the IPPPR report, but we're hearing it from many other sources, and I'm sure we'll hear it from our speakers today. There's been massive erosion of the health workforce at the local and community level. It's happened here in the United States. It's a basis of, it's a function of underpay, poor working conditions, fatigue and exhaustion, people coming under siege wrongfully. And you're seeing an exit when there should be, when we know that there needs to be revitalization, very active revitalization and renewal. This is heavily gendered. We know that women constitute 70% of the workforce, constitute an overwhelmingly disproportionate part of those who are suffering in this period and exiting when they can't hang on anymore to this. So we need to address that issue. We are entering an important season right now in which at both public health level, but at statesmen and stateswomen level, there's going to be lots of discussion around what we have experienced in this 16, 17 month period of this pandemic and how we're supposed to think about the future and what priorities are we to make. We will have on Friday, the EU G20 Health Summit. It's a remote event, but it's one where we will hear some of these ideas tabled. Hopefully there will be some commitments, but I'm not so sure we will see that, but there is a process of high level renewed discussion going on. And that creates some opportunities. It creates opportunities for many players, including the United States government, to get more deeply engaged. We'll have the World Health Assembly starting on the 24th through the end of May. Many things will happen there, including discussion of the independent panel report. We'll have the G7 meeting June 11th to 13th in Cornwall in the UK. The Boris Johnson government has put down 5 priority areas. Basic capacities figure in that, and we should think about that. Here at home in the United States, I think it's fair to say that we're entering a period of rethinking what global health security, what's the US global health security strategy going to look like in a period in which we're not going to just it's looking increasingly that we're not going to get a predominant control in most of the world or much of the world over COVID. We're going to be living in a world of endemic COVID. We're going to be living in a world in which highly variable control over that. And it raises all sorts of questions of how do we proceed? How do we proceed under those circumstances? And these are issues that are directly relevant when we're talking about workforce and we're talking about community healthcare systems, primary care systems. I was encouraged that the White House yesterday came out and said that Mr. Zients, who heads the COVID-19 response, would be guiding the international response. That's showing that the international strategy is gaining in prominence in this period. So we need to change, we need to elevate, we need to get concrete and set our goals and what are the institutional capacities that need, and what are the strategies we're going to pursue both bilaterally and multilaterally. So thank you all. I look forward to the discussion. And I want to thank Catherine, Michaela, Michael in particular for carrying us forward, and Asaf and Nikolai for being such active and fruitful contributors to our work along with Beth. Thank you.
Thank you, Steve. It's really a pleasure to engage in this timely discussion today. And as Steve has said, the value of resilient health systems and the relevance of strong primary healthcare services to global health security have really been reinforced over the course of the COVID-19 pandemic. Now, last year in 2020, there were reports of healthcare personnel diverted from routine duties to outbreak response. Information came out in many places that people were afraid to go into clinics because they were concerned about being infected with coronavirus. Or we saw people neglecting routine diagnostic tests, procedures, and follow-up because they were convinced clinics were closed or short-staffed, or maybe they just felt there was no reason to bother within the context of the larger crisis. Surveys suggested that routine immunization services were disrupted, at least at first. But now in some locales, coverage numbers are stabilizing, facilitated by strengthened coordination with primary healthcare providers who are based at the community level and in whom families often have a great deal of trust. And now the distribution of COVID-19 vaccines also demonstrates the important linkages between primary healthcare and immunization, and that this can be a dynamic relationship. Strong primary healthcare services can facilitate the delivery of immunizations, but at the same time, immunizations offer an opportunity to engage with people coming in for them and provide a broader suite of primary health services as well. So we have a great group of speakers today to shed light on new research, new approaches, and new strategies for better situating primary healthcare and immunization services within a global health security framework. I'm really pleased to welcome Asaf Bitan, Executive Director of Ariadne Labs and a member of the faculty at Harvard Medical School, Nikolai Gilbert, President and CEO of PATH, and Carrie Peltzman, Acting Assistant Administrator of the Global Health Bureau at USAID. So before we get started, let me remind those of you in the audience that there is a button on the event website that you can use to submit a question. And we'll leave time for audience comments toward the end of the session, but please feel free to submit those at any time throughout the discussion, and we'll get to those at the end. So Carrie Peltzman, let's start with you. Earlier this spring, USAID released its vision for Health System Strengthening 2030. And it links strong primary healthcare programs to global development goals and to global health security. Now, USAID has supported country efforts to build strong community-based health systems for quite some time. And there's been an office focused on health system strengthening at headquarters for a number of years too. So I wonder if you can say a bit about, what was the impetus for USAID to develop a 2030 vision, this health system strengthening vision? And what are the key components? What's different and new about this vision as you look forward over the next 9 to 10 years?
Great. Thank you, Catherine. And thank you for inviting me to join this discussion today and to represent the U.S. Agency for International Development and our Bureau for Global Health. I'm also honored to speak along such distinguished panelists. I do want to thank CSIS, the Commission on Strengthening America's Health Security, and the Bill and Melinda Gates Foundation for their support to raise awareness about the connection between health systems and immunization. And I wanted to just touch on that a bit before getting to your specific question on the health systems vision for 2030. As a result of the global community's efforts, an estimated 37 million children's lives were saved over the last 20 years due to immunization. 1 billion children were immunized in the past decade. Through the US government's 20-year partnership with Gavi, the Vaccine Alliance, USAID has driven toward its goal to prevent maternal and child deaths by helping to immunize more than 822 million children, and our partnership has saved more than 14 million lives. As we all know, immunization has one of the highest returns on investment. For every dollar invested in immunizations, a $16 return on investment is generated to health systems from the saved costs of treating illness. As we know, unfortunately, the COVID-19 pandemic has led to not only a grave loss of life, but is also, as Steve mentioned, and you touched upon as well, widely disrupted essential health services such as immunization and diverted attention and energies of governments and communities away from primary health care. 1 year after the start of the pandemic, 1/3 of countries continue reporting disruptions in routine health services, threatening global health gains that have been made over decades. Immunization services were among the most drastically affected in the early months. While many countries have restored immunization services, as you mentioned, an estimated 228 million people, mostly children, remain at risk of deadly but preventable diseases such as measles and polio. So I do think that in light of the pandemic, as we've touched upon, vaccines are center stage. We are partnering with Gavi and COVAX to deliver safe and effective COVID-19 vaccines for 92 countries and economies through our support to the COVAX Advanced Market Commitment. To date, the United States government through USAID has already contributed an initial $2 billion to Gavi in support of COVAX, the largest single country contribution COVAX has received to date, and will contribute an additional $2 billion to Gavi through 2022. This unprecedented investment from the US, together with global partners, represents a unique call to action, not only to deliver COVID-19 vaccines, but also to strengthen the health systems that must be responsive to the ongoing needs of communities and countries. And primary healthcare is at the center of that response. While there's an urgent need to deliver COVID-19 vaccines, we also have to ensure that the vaccine effort does not become another vertical initiative driven by global partners and divorced from other needs and priorities of communities. As more resources are deployed to prepare and plan for the delivery of COVID-19 vaccines, we need to take this opportunity to approach health system investments more holistically so that a foundation is laid for more sustainable results. And this gets to the vision for Health System Strengthening 2030 that you alluded to. It means updating our focus to approaches that will impact multiple areas of the health system simultaneously, such as through aligning resources and policies to strengthen supply chains and improve cold chain capability, expanding the quality and use of information management systems, more effectively engaging communities in identifying and meeting their health needs, and enabling a sustainable health workforce so that critical health services can be delivered uninterrupted and more effectively and equitably. Investments we make now to end this pandemic can strengthen health systems in ways that protect communities from ongoing health threats, as well as the next pandemic. And just touching on the focus on communities, USAID has partnered with country governments and multilateral and bilateral donors, private funders, and global health leaders, including the Bill and Melinda Gates Foundation, to form the Community Health Roadmap. It's an innovative collaboration to better align efforts and existing resources and to attract new investment to community health. Communities are central to a whole of society approach to improve the quality, equity, and resource optimization of a health system. And that's really a core focus of the 10-year vision for health system strengthening that we launched this year to really lead this shift. We want to support more comprehensive and locally driven approaches that impact multiple areas of the health system, that engage local organizations and communities for greater accountability and ownership, and leverage the resources and strengths of multiple sectors to build more comprehensive primary care and prevention services. These are ways in which we can support countries to strengthen their health systems, to build resilience, and support equitable access to primary healthcare services like immunization. Looking ahead, our priorities and the vision are focused on the health system at large to build resilience, ensuring that people have the care they need when and where they need it, and ensuring that primary health care is prioritized so that immunization is valued and integrated into broader health opportunities. We hope that the new vision for health system strengthening will be a guide to help to achieve this. So we really see this as an important opportunity, as has already been touched upon, and can't really lose sight of that bigger picture when we're talking about health systems. The COVID-19 pandemic offers us the opportunity to examine how we can help countries become more resilient and our cooperation more effective. And that's a large part of what is driving the Health Systems Vision Strengthening 2030. Thanks.
Carrie, thank you. Let me turn to Nikolai Gilbert of PATH. Carrie has laid out some of the key elements of the new USAID vision, really emphasizing the important role of the community, of collecting data and ensuring the broad integration of many different kinds of health services at the community level. Now, PATH also has a new strategy on primary healthcare, and in some ways it's also framed as a way of integrating many of the different areas of health on which PATH has engaged over the past several decades: maternal and child health, tuberculosis, HIV services, malaria, and even focus on non-communicable diseases like diabetes. But there's also a new or maybe reinforced emphasis on people, data, and health equity as well. And so I wanted to ask you to explain, what do you mean when you talk about people-centered, data-driven approaches to primary healthcare? And how does this focus for PATH enable you to reach health equity and approach universal health coverage to support countries in that quest by 2030 as well?
Thank you, Catherine, and good morning, everyone. Hope you are safe and well. And thanks to you, Catherine, Steve, to CSIS and your colleagues for organizing this event together with your partners. It's great that you're putting focus on primary healthcare and health system strengthening. It's really appreciated. And just to also reiterate what Carrie said before, I think USA, having taken this topic and with their 2030 strategy on strengthening health systems, is really important for our whole sector that we see this focus from a major actor like USAID. So thanks to Carrie and her colleagues for that. Because, we know primary healthcare and health system strengthening, they really goes hand in hand. Health systems, when we talk about strengthening those, they cannot become strong if primary healthcare is weak. Well-functioning health systems and primary healthcare is, I think, and still is our first line of defense against infectious diseases, but now also silent epidemics from non-communicable diseases like diabetes. And people-centered really means that we have to meet people where they are. We've seen this with COVID. We need to address their health needs in the communities they live, where they are seeking their guidance, where they are seeking their treatment and their immunization, and where they get support from health workers that they trust. Our health needs are broad, and they cut across many vertical health areas and prioritization of those health areas. So people-centered primary healthcare also means that it's a holistic view where people is really at the center. And there are many, many components in a well-functioning primary healthcare system, as we know, and I will not try to mention them all here, but there's all the hard infrastructure components: electricity, buildings, facilities, refrigerators, cold chain, water, sanitation, that I know you, Catherine, has also put emphasis on. And naturally, access and availability and affordability to vaccines, therapeutics, diagnostics, they're all fundamental. But in the center of all that is obviously patients, people, but also the workforce that Steve talked about. The people, the doctors, the nurses, the community health workers, their knowledge and the systems and data they use to help patients, and how they gather data and share these data across different areas for non-communicable diseases and also infectious diseases, pandemic surveillance, all are critical components that we need to have in mind. And this is the place, primary healthcare, where our health needs are addressed. This is where universal health coverage begins, and also where global and national health security should anchor itself. More specifically, also, Catherine, on the people dimension. So, as we have heard, COVID-19 has really underscored the importance of delivering quality health services closer to home. in the communities, whether in remote areas, rural communities, or in urban settings. Better primary healthcare, that really means that we need to work with the communities and individuals, not only in the delivery of care, but also in the design and how we create the best solutions that works for that local context and driven by the needs of those communities. So our work across primary healthcare incorporates also health users in the design, be it community members, patients, and their families, healthcare providers, government actors, subnational actors, to ensure that those services are meeting the needs and that are specific for a given context. This is also what we mean with people-centered. In terms of the data, that's obviously a central aspect, information, access to information. And being data-driven, it means that we gather data, we encourage patients, families, communities, and the system to look at the data first to guide decision-making and any interventions that are decided upon. Our approach enable a collection of holistic, not only health area by health area vertically, but a holistic gathering of data that can be used across from various events, various disease areas to look for these larger trends and have those systems work together seamlessly so that we can have an opportunity to improve care and understand the needs. And bringing those two concepts together, the data-driven and the people dimension, we are actually working to build that trust so that people also are comfortable with sharing their data. So issues like data ownership, privacy, of course, needs to be addressed. But data is essential for also improving primary healthcare, and this will also help us move forward on these priorities.
Nikolai, thank you very much. Asaf, let me turn to you. You're a practicing primary healthcare practitioner in addition to your work at Ariadne Labs. Both Carrie and Nikolai have emphasized the importance of people and of communities, but they've talked a lot about resilience as well, the issue of resilience. And I want to ask you, from your perspective, what does resilience mean in the context of a pandemic? What does it look like if we're trying to envision what resilience looks like? And why is it important to involve communities and people in the conversation about their health system and focusing on a resilient system itself?
Well, thanks so much for the question, and I'm delighted to be here on this panel. The simple definition that I use for resilience in a health system context is really the ability for a health system to respond to a crisis while also maintaining essential health services in the face of that health shock. And, for COVID-19, I think this has been the one singular statistic that I keep drawing on that embodies the importance and challenge of resilience in the health system's context is the fact that for a suite of crucial preventative immunizations, 25 years of progress was lost last year in 25 weeks. 25 years of progress in the immunizations that Carrie laid out was lost in those 25 weeks. And so resilience is really emphasizes a set of functions that are really a dynamic dimension, and that dynamism is often in contrast to the static health system models or the rigidity of missions that many health systems in many countries have. Resilient health systems have 5 interrelated properties. They're aware, they're diverse, they're self-regulating, they're integrated, and they're adaptive. What does that mean? It means when they're aware, they track population health threats, they map system strengths and weaknesses, they know where available resources and workforces are. When they're diverse, they are able to address a range of health problems along the continuum of a person's lifetime, along the continuum of communicable to non-communicable and behavioral health dimensions. When they're self-regulating, That means that they're able to minimize that disruption to essential health services when a crisis occurs. They're able to isolate those threats and access reserve capacities. And when they're adaptive, they are able to obviously transform their operations and be agile, act on new evidence and feedback, encourage flexible response. And when they're integrated, they coordinate across government, local, global, private actors. They work across sectors and they involve communities. So those features don't arise in a vacuum. They require strong local and national leadership. They require interconnectedness. There's a sort of smart dependency there. That doesn't sort of limit itself to geopolitical boundaries. And this is what's really important about the concept of resilience, is that resilience is not self-sufficiency. It's not about, having a set of plans and implementing them. It's about those integrated, adaptive, agile, community-based, interlinked responses. And that's where primary healthcare comes in so importantly here, because primary healthcare addresses the majority of a person's health needs over their lifetime, across their needs spectrum. It has the components of meeting those needs across their life, addressing broader determinants of health through multi-sectoral action, and empowering individuals, families, and community to take charge of their health. And so it provides care in the community as well as care through the community. So it's not just about, clinicians in the four walls of a box waiting for people to come. There's an outreach, there's a proactive, prospective, population-based component. And all this has been defined from Alma-Ata on to Astana in the global health perspective, but it's an intensely local, community-oriented set of approaches that not only is clearly shown to improve health outcomes, but also it's one of the few parts of the health system that reliably improves health equity. And so the sort of the localization of PHC as not a set of services, not a service line or just a set of clinical angles, but really a community-oriented approach to whole person integrated care, systems that are oriented toward that PHC community direction are also systems that have the resilience to withstand these health shocks, maintain essential services, and bounce back better.
Asaf, thank you. I mean, really emphasizing, the importance of rooting those experiences and, the vision in how people themselves experience their interactions with each other, with the community, and with their providers as a way of building a stronger system over time. Carrie, I want to come back to you and really look at the country level and ask you about some of the countries where USAID has made health systems investments over the past number of years. Thinking about the COVID-19 pandemic, can you share some examples of where you see that USAID health systems investments have been an asset, have really helped communities respond in a resilient way? I guess helped them both respond and support the community within the current crisis. And I guess I would add, how do you see those systems really supporting COVID-19 vaccine delivery programs as they get rolled out across lower and middle income countries?
Thanks, that's a great question. And actually, I'm just struck that Nikolai and Asaf and I all seem to sort of be saying the same thing in slightly different ways, but I think the agreement on the primacy of equity and the community and PHC at the center. And I think that, equity is one of the drivers in the new health systems strengthening vision, but also, when I think about the work that USAID has done over decades really on building primary healthcare and strengthening health systems, I think our work on routine immunization and particularly around polio eradication is an illustration of where health systems development work is creating a platform both for responding to the pandemic and its needs, but also to increase the linkages to the community and build that trust. And many of the tools, for instance, in our polio eradication work are going to be so crucial for the response and going forward with vaccine delivery. And I think about, the network of polio outreach workers who have been, trained and then used to do outreach work around risk communication and community engagement, and whether that's on mask wearing, social distancing, hand washing. I think we've also done work to ensure that there's training available for healthcare workers on critical care needs specific to the COVID response. And I think developing that capacity using innovative tools like virtual platforms to help deliver that training to adapt to the context of the pandemic response. I think another illustration I might use is our work under the President's Emergency Plan for AIDS Relief, specifically with PEPFAR, where we have deliberately invested more and more of those precious resources on the HIV/AIDS epidemic to build capacity of local partners in particular. And many of those local partners were very well positioned, given their close relationship to the communities they serve, given the capacities and skills developed with PEPFAR, to then turn and help support the COVID response. So we have seen illustrations of that, particularly in countries where we have significant PEPFAR programming. And I think the final illustration I might point to is our work on global health security and USAID's contributions to the global health security agenda. Again, so many of the core pandemic response efforts have been linked to our work on global health security. The efforts we've made on laboratory strengthening, on workforce development and training, infection prevention and control was so central to this response, as well as risk communication. Those are all tools that cut across many of our programs and have been efforts to strengthen health systems for outbreak response over years. And many of those same partners and resources and approaches are being applied in the COVID response, and then will also be important components of our work following and in preparation for future pandemics and outbreaks.
Thank you. So Asaf, coming back to you, week before last, I think, or at least in the last couple of weeks, Ariadne Labs and the Primary Healthcare Performance Initiative put out a toolkit and I think other resources to guide thinking at the global and national levels, about how strong primary healthcare programs can contribute to a successful COVID-19 vaccine rollout. I mean, obviously these are, sort of historic, investments that can, ultimately culminate in a strong response. But at the same time, it sounds like there are things steps that can be taken now to ensure a smooth rollout as well. So can you say a bit about, what these organizations have been, learning about how to harness primary healthcare programs to support the vaccine distribution, and a little more as well, what opportunities are there or that you see to strengthen primary healthcare really coming out of the COVID-19 crisis?
Yeah, thanks. So PHC and immunizations, they go hand in hand. They're mutually interrelated. They're not interchangeable. PHC encompasses more than immunizations, in the process of getting from bench to community side, not bedside. For immunizations requires more than PHC, but they obviously are part and parcel and are mutually supportive, and when done best, don't exist as sort of completely separate areas. So PHC can really help ramp up for COVID-19, but really for all vaccine preventable diseases, at least in 4 ways: the ability to provide robust immunization capacity. I mean, first, that community and person-centered orientation really increases confidence, trust, and interest in vaccines. I don't think we have to sort of belabor the point, but we are in a trust game with providing vaccines, and that's not just in the clinic. That is a societal trust arbitration. If there is no trust, you essentially have no needles in arms, and vaccines are useless unless they get into people's arms. It's as simple and as complicated as that. So the ability to be that trusted point of care, that trusted point of respect in a community, because the orientation of primary healthcare is so community dependent, to be able to patiently respond to questions and concerns. I mean, I'm doing this as a large part of my clinical role, but PhD systems do this as a large part of their part and parcel everyday role. PhD is critical to guiding, in the second part, really an equitable response, because not only from an allocation perspective, because it provides such an important stream of allocation, but really from that awareness of where people fall behind, who is not being counted, who is not being served, who needs to be reached in that last mile. It leans, countries can lean on PHC's existing sources, as Nikolai and Carrie talked about, data collection, and its inherent surveillance capacity, and in its capacity to denominate, to understand denominators through processes of empanelment, knowing who in which populations you serve. That is the first part of equity. The third part is that PHC workers are so well equipped to safely and efficiently distribute vaccines because they're the main part of the healthcare workforce that delivers vaccines on a day-to-day basis. They're proximate, they've got the relationships, they've got the distribution points. And finally, you know, not only do they distribute vaccines, but they can collect accurate data on coverage, on implementation, on roadblocks, on barriers. And so we're really seeing that, you know, in order for the vaccine supplies and in order for the vaccine campaigns to work, they have to be centered in PHC itself.
Asaf, thank you. Let me turn to Nikolai. So Nikolai, you know, as Carrie and Asaf have both pointed out, I mean, this is a dynamic, you know, relationship, you know, between primary healthcare and immunizations that can be mutually reinforcing, but are certainly separate areas of focus and funding and support as well. But, you know, let me ask you, as COVID-19 vaccines continue to be distributed, we know that globally there have been considerable challenges in scaling up the extent of availability of COVID-19's vaccines internationally. But as they continue to be distributed and as it eventually becomes possible to envision a transition away from this acute phase of the pandemic, whenever that will be, what are the primary healthcare thematic areas that you see focusing on kind of beyond the pandemic to ensure better preparedness and response in the context of future outbreaks?
Thanks, Catherine. Well, I mean, we have suffered a lot during COVID, but I think we have also learned a lot during the process, and the need for strengthening immunization and all primary health programs to deliver vaccines and other healthcare services across the life course has become so clear during COVID-19. So what we can imagine is maybe a near future where the COVID-19 vaccine is delivered as a routine immunization service that both serves children but also adults. And strengthening the basic services of primary healthcare is a critical pathway to preventing future outbreaks. So we need to obviously continue to support the pandemic response in the urgency we are in now, but also already now start to think about how do we invest in new technology? How do we go away from this vertical disease focus and start thinking about it more holistically? And I think what we have seen with COVID as well is that it's been where there has been a policy and an implementation of that policy that you can meet your healthcare needs in one place, which has been very needed during COVID. We see that there is something to build on with from that experience, that you can actually address all of those healthcare needs in the communities and in one place of point of care. I think that's really important. It's also going to be very important that resources, financing, and political commitment is going to be there also when the pandemic reduces its impact on all of us. Those long-term investments in the systems, in the primary healthcare, in the workforce, in the hard infrastructure and the soft infrastructure, all of that needs to happen, and also when we don't have a pandemic to deal with. And that's why when you see actors like USAID come out and say we want to invest in strengthening health system, that's very important. If we can bring others with us in that focus on workforce, on systems, and so on, then we have a chance also to do a better job. I think next time around, because there will be a next time around. And as was also mentioned, we need to double down even more about the inclusiveness and the people center and how we strengthen that integration. I think that's going to be critical. The quality of care is going to be necessary to focus on. It's not just the access, but also the quality. And this is a partnership. So we're not going to do this one organization or one partner. We need to work together. And it sounds maybe very simple, but we need government leaders, investors, grassroots groups, NGOs, governments, donors. All of us needs to be committed to improve health systems. So we have a lot of work to do together.
Asaf and Carrie, we've had a long conversation this morning about the importance of incorporating people's voices and situating care at the community, the importance of trust and building those trusting relationships to create more resilient and servicing, and engaged services. We had a few questions from the audience, but one Nikolai has already really touched on in terms of priorities for strengthening primary healthcare systems and overall resilience in the long term. But let me ask each of you for kind of beyond this list that we've talked about, your kind of one or two visions or wishes for work on primary healthcare in the post-pandemic period. Asaf, maybe we'll start with you.
Oh, I only get one or two.
One or two, that's all.
Well, I really see this, building off the points that were made earlier, I really see this as an inflection point and an opportunity to really ask, from your first questions, how do we build the resilient, effective health systems that can respond to tomorrow's health shocks? And also, by the way, deal with still unacceptable levels of disease burden, ill health, inequity. And so the opportunity here is not just to see primary healthcare as a distribution mechanism for immunizations, though it is a very strong distribution mechanism, but rather to see it as a sustainable investment route, as an opportunity to double down on a best buy that will be able to create the systems that surveil and respond and adapt to these health shocks, that are able to follow and help people over their lifetimes, and are accountable to communities, are driven by multi-sectoral action, and have that locus of community orientation and health workforce sustainability that enable them to not just make this an investment in response to COVID and then the next COVID happens. I mean, and I think that just, I think in granular terms, things like, for instance, we're involved with USAID in something called Momentum, which is really about how to improve maternal newborn child health. And what, Momentum is sort of focused on this idea that, how do we accelerate innovations through partnerships and in and around resilience, improving healthcare delivery in both private and public sectors, accelerating and scaling knowledge about how to best translate practices and management practices, and how to make sure that our investments in global health through things like Momentum, through other multilaterals and domestic investments, how do they not just sort of invest in yesterday's vertical, but rather invest in tomorrow's scalable, sustainable health system that'll meet the needs of community? That's the opportunity with COVID, and I really hope that we take that opportunity.
So partnerships are important, but we really need to harness the energy of the moment to identify and invest in new tools and new ways to reach people. Carrie Peltzman, the last word I think is yours, but let's, if you could share, where do you think the vision beyond 2030 will go? What do you see as key elements for a vision for primary healthcare and health systems for 2035 and beyond?
Well, no, thank you. And I think, you touched on some of the core points that we've been highlighting, the issues of equity, resilience, people-centered communities, primary healthcare trust. I think that the value of our health system vision for 2030, and I'll get to 2035 in a moment, but really, the fact is that it focuses on these key strategic outcomes of equity, quality, and I appreciated, I think Nikolai mentioned quality of care and resource optimization. So that goes to the question about funding and partnership as well. I do think the beauty, and I have to give credit to the director of our Office of Health Systems, Kelly Saldana, and her team for driving the vision, is the linkage to universal health coverage and the Sustainable Development Goals, and that we really can't achieve either of those two global priorities for us in health without this system strengthening and all of the key tenets that we've been covering today. And it also goes back to pandemic preparedness and global health security and how we can be better positioned and ensure that the health systems are resilient and able to withstand potential future shocks or stressors like COVID-19, and be able to not have the setbacks and the regressions that have been mentioned in terms of immunization or other key health services and priorities, and move us toward universal health coverage and the SDGs. So I think, I can't project beyond 2030 at this point, but I do hope that our vision helps to move this whole agenda forward towards those major priority goals.
Well, Asaf, Nikolai, and Carrie, I want to thank you for taking the time today to share your research, your insights, and a little more detail about your new strategies. And I want to thank the CSIS audiovisual team and Michael Rendelman and Michaela Simoneau from the Global Health Policy Center for coordinating the details of this event. And just to tell the audience, if you are interested in more CSIS content on these issues, please check out the Commission on Strengthening America's Health Security podcast, which is called Pandemic Planet. And that features conversations with leading global health experts on topics like primary healthcare, immunizations, COVID-19, and more. And please look for a notice for the second in this series about building resilience, which is looking at primary healthcare and immunizations. We'll be taking a closer look at how to put some of these strategies and ideas discussed today into practice, and that will be in late June. So thank you all very much, and we are adjourned.